Hi all, welcome back to my channel. I hope you guys are doing good. Again, I am back with one more interesting topic which will be very helpful for the nurses, those who are studying, as well as those who are working in the hospital. Let's see what is the topic. Here we go. Today's topic is Braden Scale. Now you may think that she said an interesting topic and finally she ends up in Braden Scale. I know that it is a bit boring topic, but as a nurse, it is very important to know about Braden scale, the components of Braden scale, how to score if a patient get admitted in a hospital. So let's see that in detail. So Braden scale was developed by Dr. Barbara Braden and Dr. Nancy Bergstrom in the year 1988. That's why the name came Braden scale because it was developed by Dr. Barbara Braden. Braden scale is a standardized evidence-based assessment tool commonly used in healthcare to assess and document a patient's risk for developing pressure injuries. That means the Braden scale is mainly used to assess the patient's risk or chance for developing bed sores. Let's see about its components. So it has totally 6 components. The first one is sensory perception. The second one is moisture. The third one is activity. The fourth one is mobility. Fifth one is nutrition. And the last one is friction and shear. These are all the 6 components of Braden scale. Based on these components, we are going to assess the risk of bed sore. And this is Braden risk assessment scale. As I said, it consists of 6 components: sensory perception, moisture, activity, mobility, nutrition, friction and shear. And the score ranges from a minimum score of 1 to a maximum score of 4. The scorings will be given according to the risk factors and it may differ from patient to patient. So the total minimum score is 6 and the maximum score is 23. Let's talk about sensory perception. Sensory perception is nothing but the ability to feel the sensation. For instance, we normal human beings, when we go to bed, first we may lie down in a supine position. After sometimes we may turn to lateral position, prone position and so on. Why? Because we all have the ability to respond to pressure related discomfort. So in order to make ourselves comfortable, we are changing the position. That's what it says. And mainly the scoring is depending upon 2 main factors. First one is level of consciousness. That is whether the patient is conscious, semi-conscious or unresponsive. And the second one is ability to feel cutaneous sensation. That is what I explained with an example. So here we can see how to give the score according to the sensory perception of the patient. So as I explained already, the maximum score is 4 and the minimum score is 1. And based on 2 main things, we are giving score here. The first one is the conscious level of the patient and the second one is the ability to feel the sensations. So here, first, if a patient responds to verbal commands and patient don't have any sensory deficit, in such case, you can give a score of 4. For instance, the patient is talking normally, okay, and the patient don't have any sensory deficit. That means the patient can identify the pressure related discomfort or pain and report to us accordingly. So in such case, you can give a score of 4. Then, if a patient responds to verbal commands but cannot always communicate discomfort or the need to be turned because he has some sensory impairment that limits the ability to feel the pain or discomfort in 1 or 2 extremities. So here the patient will be normal, the patient can respond normally, but the thing is Due to a mild sensory impairment, most of the time the patient cannot communicate the discomfort or the pain to us. So in such case, you can give a score of 3. Here in score 2, this is for patients only responding to pain. Okay, so almost the GCS drop here, and they cannot communicate discomfort except by moaning or by restlessness, and also has a sensory impairment that limits the ability to feel pain or discomfort over half of the body. In score 3, we have seen a mild sensory impairment. In score 2, almost half of the body, they lost the ability to feel the pain or discomfort. So in such case, you can give a score of 2. And the last one is unresponsive. Okay. And also limited ability to feel pain over most of the body. Okay. So if the patient is in this category, then you can give a score of 1. Clear? The second component is moisture. As we all know that excessive moisture will lead to bed sore. So here the moisture risk factor is defined as the degree to which skin is exposed to moisture. So moisture can come from several sources such as perspiration, that is excessive sweating, urinary incontinence, stool incontinence, or wound drainage. So prolonged exposure to moisture increases the risk of skin breakdown. Let's see how to give a score based on moisture. Here also the maximum score is 4 and the minimum score is 1. So if the patient is rarely moist, that means skin is usually dry, you can give a maximum score of 4. Then if the skin is occasionally moist, that means the patient requires an extra linen change approximately once per day, you can give a score of 3. And often moist. So the skin is often moist but not always moist. Okay, and you need to change the bed sheets at least once per shift, that is approximately 3 times per day, then you can give a score of 2. And the last one is 1. So if the patient's skin is constantly moist, okay, due to perspiration, urine, stools, drain, etc. Dampness is detected every time the patient is moved or turned. So whenever you are turning the patient or whenever you are moving the patient, you find dampness in the patient due to perspiration or continuous passage of stools or urine, then you can give a score of 1. The third component is activity. Activity means the ability of a person to get out of the bed, move around and ambulate with or without help. So the activity risk factor is defined as the degree of physical activity. Level of activity is defined by how frequently the patient is able to get out of bed, move into a chair or ambulate with or without help. Let's see how to give the score based upon the activity level of a patient. Here again the maximum score is 4 and the minimum score is 1. So you can give a maximum score of 4 to a patient who walks frequently. That means walks outside the room at least twice a day and inside the room at least once every 2 hours during the waking hours. In such case, you can give a score of 4. Then, if a patient walks occasionally, so walks occasionally during the day, but for very short distance with or without assistance and spends majority of time in bed or chair. So if a patient walks occasionally, most of the time patient will be in the bed or chair, then you can give a score of 3. Score 2 can be given for a patient who is chair fast. That means patient cannot walk or cannot bear their own weight. So we need to assess the patient to move the patient from bed to chair. If you make the patient to sit in the chair, the patient can sit in the chair. So in such case, you can give a score of 2. And the last one is bedfast, that is bedbound, bedridden. The patient will be totally confined to the bed. In such case, you should give a score of 1. The fourth component is mobility. Mobility means the ability of a person to change or control their body position. For instance, a healthy, normal human being can change their position according to their comfort. For instance, we are sitting in a chair for a long time, we will change the position by shifting the weight to right or left, sometimes by sitting cross-legged. Okay, so according to our comfort, we are changing our position. And also, it depends upon the muscle power too. However, tissue damage will occur if a patient is unable to reposition on their own power. Let us see how to give the score based on mobility. Here also, the maximum score is 4 and the minimum score is 1. So if there is no limitation, okay, the patient can make frequent position changes without any help. Independently, the patient is moving by himself or herself, then you can give a maximum score of 4. And in 3, there will be slight limitations. That is, patient can make slight changes in body or extremity position without assistance. You can give a score of 3. And in 2, patient can make occasional slight changes in body or extremity position but unable to make frequent or significant changes independently. That means the patient needs assistance in order to maintain position. So in such case, you can give a score of 2. And the last one is completely immobile. So the patient will not make even slight changes in body or extremity position without assistance. So here, for example, you are providing supine position for a patient. Until you come back, the patient will be in the same supine position. The fifth component is nutrition. As we all know that nutrition plays a very important role to make us healthy, and protein is very important for wound healing. So here, the nutrition risk factor is defined by 2 categories. The first one is the amount and type of oral intake, and second one is for the patients receiving tube feeding, total parenteral nutrition, that is TPN, and patients on liquid diets or NPO. Here we can see how to give the score based on the nutritional status of a patient. 2 things we need to consider here. Number 1, the type and amount of oral intake, and number 2, the patient on tube feeding, on total parenteral nutrition, on prescribed clear liquid diet or NPO, nil per oral. So here the maximum score is 4 and the minimum score is 1. If the food intake is excellent, you can give a score of 4. That means eats most of every meal, take 4 or more servings of protein per day, does not require any supplementation, everything is excellent, you can go for a score of 4. And in 3, if the patient is taking adequate amount of oral intake, you can give a score of 3. That means eats over half of most meals served and taking 4 servings of protein per day, and supplements if offered, patient is taking. On the other hand, if the patient is on tube feeding or total parenteral nutrition regimen, you can give a score of 3, because once they decided to put the patient on tube feeding or TPN, these things will be given based on the calorie requirement of the patient. So if a doctor or a dietitian advises us to give 6 tube feedings per day and we can give all the 6 feedings without any problem, you can give a score of 3. That means we are meeting the nutritional demand of the patient as advised. Then score 2, probably inadequate. That means the patient will have only half of any food offered, taking only 3 servings of protein per day. Or if the patient is on tube feeding, the patient is receiving less than the optimum amount. That means if the dietitian or the doctor advised to give 6 tube feeding per day, and due to some reasons, it might be refusal from the patient or due to some clinical conditions, we cannot give all the 6 meals and we feel like we are giving less than the optimum amount, then you can give a score of 2. And the last one is very poor intake. That is, always refuse the food. If you compel, patient may rarely take 1/3 of any food offer, only taking 2 servings of protein per day, and the fluid intake is very poor and does not take any supplement. Okay, and if the patient is on nil per oral or on clear liquid diet or on IV fluids for more than 5 days, you can give a score of 1. So in short, if the food intake is excellent, give a score of 4. If it is adequate or the patient is on tube feeding or TPN regimen, you can give a score of 3. And if the intake is probably inadequate or we cannot give the optimum amount of liquid diet or tube feeding due to some reasons, you can give a score of 2. And if the intake is very poor or the patient is on NPO or on clear liquid diet or on IV fluids for more than 5 days, you can give a score of 1. Clear? The 6th component is friction or shear. So friction and shear are mechanical forces contributing to pressure ulcer formation. So friction wounds are caused when the skin is rubbed against another object. For example, the friction between the patient's skin and the bedsheet. The shearing wounds occur when forces moving in opposite direction are applied to tissues in the body. This can occur when the skin is stuck to a surface such as bed while gravity forces the body downward on the bed. For example, you are making a patient to sit in the bed by elevating the head end of the bed and you are providing food for the patient. After 5 minutes, you notice that the patient slides down. So in this situation, what happens? The skin of the patient at the back stuck to the surface of the bed while the gravity forces the body downwards on the bed. That means the skin will stick to the bed and the tissues and the bone will be moved downwards. So what will happen? There will be compromise of blood circulation in between the skin and the tissues. So it will end up in bed sores. That is the effect of shear, which will lead to bed sore. Let us see how to give the score based on the friction or shear risk factor. An important thing to note here is the maximum score is 3. So in all the other 5 components, the maximum score is 4. And in the last component, friction or shear, the maximum score is 3 and the minimum score is 1. So here, 3 main things we need to note. If the patient can move in bed and chair independently and has sufficient muscle strength to lift up completely during move, maintains good position in bed or chair at all the times, then there is no apparent problem. So the patient can freely move. There is no necessity to assess the patient or to slide the patient or no chance of getting friction or shear bed sore if the patient has adequate muscle strength. So if there is no apparent problem in all these 3 concepts, you can give a score of 3. Here, potential problem. So here, only 50% effort from the patient and 50% effort we need to give. So sometimes we need to slide the patient by using bed sheets, right? So there may be a chance of friction force or shearing force which will end up in bed sore. So if the patient is having some potential problem, you can give a score of 2. Then in score 1, problem. So here you cannot expect anything from the patient. All the 100% effort as a nurse you need to give. So here complete lifting without sliding against the sheet is impossible because the patient is not at all putting any effort. Okay, so 100% we need to assess the patient in order to move. So of course the patient may be exposed to more friction or more shearing effect which will end up in bed sore. So let me summarize this one. This is Braden Risk Assessment Scale. We have seen all these 6 components: sensory perception, moisture, activity, mobility, nutrition, friction, and shear. And now we know how to keep the scorings according to the condition of the patient. Here is the Braden scale interpretation. So the total score range from 6 to 23. So the minimum score is 1, I said. The total components are 6. So totally 6. That is the minimum score, and the maximum score is 23. For all the 5 components, the maximum score is 4. So totally 20 plus the last 6th component, the maximum score is 3. So 20 plus 3, 23. So the total score ranges from 6 to 23. As the score increases, the risk for bed sore decreases. If the score is less than 9, the patient is at very high risk for bed sore. If the score is between 10 to 12, the patient is at high risk for bed sore. If the score is between 13 to 14, the patient is at moderate risk for bed sore. If the score is 15 to 18, the patient is at mild risk for bed sore. If the score is 19 to 23, the patient is not at risk for bed sore. So as I said, the score increases, the risk for bed sore decreases. As the score decreases, the risk for bed sore increases. Let me end up with a case study here. A 50 years old lady got admitted in the hospital with complaints of multiple episodes of vomiting and urinary incontinence, responds only to painful stimuli, and has sensory impairment, bedbound, always sliding down in the bed, needs frequent positioning, and kept NBO. What is her Braden risk score? So here, sensory perception, moisture, activity, mobility, nutrition, friction, and shear. All the components are here. And sensory perception, here as it is mentioned, the patient responds only to painful stimuli. I gave a score of 2 and also has sensory impairment. Moisture, here it is stated the patient is with urinary incontinence. So the patient will be completely moist. So I gave a score of 1 for moisture. Activity, here it is clearly mentioned patient is bedbound. So I gave a score of 1. Mobility, patient needs frequent positioning. So we cannot expect anything from the patient. Patient cannot do anything by herself. So I gave a score of 1. Nutrition, as it is mentioned, patient is on NPO. So I gave a score of 1. The last one is friction and shear. So here always sliding down in the bed. So there is no effort from the patient side, no muscle strength, nothing. So I gave a score of 1. So the total score is 2, 3, 4, 5, 6, 7. The Braden score is 7. So the patient is at high risk of developing bed sores. This is the way what you have to calculate the Braden score. Thank you so much for watching my video. I hope this would be helpful for you guys. kindly share and subscribe my channel. My channel name is Jebin Chain. See you all later with one more interesting topic. Until then, it's bye from Jebin. Bye bye. Take care.